Hello, I'm Bridgett Wallace. I'm a physical therapist and I'm course director and faculty for the Certificate of Competency in Vestibular Rehab, or CCVR course. I am super excited about our faculty. It's been so inspiring to develop the content. And I love the flexibility of the online format, where you'll be able to follow us weekly or watch the lessons at your own pace. You'll also have access to 2 days of problem-solving vestibular cases. And this will not just be those simple case studies, but complicated ones. And we'll be sharing stories, success stories, and not so successful stories, because those are the ones we learn from the most. It requires a village. You will hear over and over the importance of a multidisciplinary approach, as well as how important it is to learn from our patients. So I would love for you to enroll in our course and be an active participant, and let's grow the vestibular community together. Thanks so much.
Current quality and value measures in medicine are becoming very difficult. One of the ways in which we've been able to determine this, and we've been able to establish value and quality, is with multidisciplinary approaches to medicine and disease. The input that we have from the therapist, the input that we have from the radiologist, the input that we have from the neurologist and neurosurgeons, all are what makes value and quality the mainstay of current medical therapy. When we're looking at this, none of us works in a vacuum. I use the therapist's information, the therapist will use our information. I think that the anatomy and the physiology is very important to understand with this in order that you can understand the entire picture. We all speak the same language, and when we are speaking the same language, we can take care of a problem in a very efficient manner. This is how we've now been able to determine quality and value in medical care.
Hi, I'm Rudie Spigarelli, and I'm an instructor in this vestibular certification course. I'm really excited to be a part of it because I think it's going to be a great way to reach a lot of people across the world. And this dizziness and vestibular disorders problem is something that really impacts people's quality of life. And what I really want you as a participant in this program to take home is that you have a great opportunity to help these people and your patients in a really important way.
My name is Emily Schottman. I'm an optometrist, a neurooptometrist, and a licensed professional counselor in Austin, Texas. My practice is austinmentalwellness.com, and I'm excited that this multidisciplinary offering is coming to you. I've been in a couple professions myself, and I just know that the synergy that can happen when we take into consideration both the emotions and the physical and the whole person's symptoms, it just can make a world of difference, both to you in your practice and to the people that you're out there wanting to help. Thanks for sharing.
Hi, I'm Natasha Johnson, and I'm a physical therapist in Austin, Texas. I work at St. David's Rehabilitation on 32nd Street, and I also work for Rehab Without Walls. And I really love working with patients that have vision and vestibular dysfunction. I really appreciate that Bridgett has created this course that looks at the interdisciplinary team approach with treating our special clients with neurological injury. I have been a physical therapist for 15 years, and I feel like it's truly a blessing that I'm able to share my gift with others, and I really appreciate the opportunity to chat with you guys. Take care.
Hi, my name is Jim Kemper. I'm a neurotologist in Austin, Texas, and I've had the pleasure of working with this organization for over 20 years. And what we found is the way to make patients better is to have everybody involved, the physical therapists, the physicians, and have communication between those two. A multidisciplined approach, if you will, to these patients is what makes patients get better. Educating patients to understand why are they feeling the way they're feeling and how can you make them get better. And they're going to play a role in that between physical therapy and compliance to medications. And I hope you enjoy the series, and I'm glad you've gone on board.